Hi, my name is Don Schmitt. I'm an interior designer in Cleveland, and I'm doing a series of videos that celebrate the aspects, the people, the different kinds of facilities, whether it's art or medicine or beauty or health or whatever. There's so much going on in Cleveland that is wonderful and exciting and world class. And I've had my own personal experience has been that over the years, and most people who know me and anyone who's seen these videos knows that I'm almost always wearing dark glasses. It's because I have a really serious eye problem for many, many years, and I've had many surgeries at other facilities and hospitals that I didn't get much of a positive result, certainly not a positive result. And I had the occasion to meet Dr. Joseph J. Ross in Westlake, Ohio at Envision Eye Specialists, and met with him, and I was cautiously optimistic immediately. His manner, his way of talking to me was very positive and very matter of fact, but also he talked to me about some of the different kinds of aesthetic healing processes they bring to the table. And I knew that this is something I hadn't heard anywhere before, and that I was in a place that was different, had a different approach, and I'm really happy to say, for anyone who knows me, when I take my glasses off now, my eyes look normal. Until 3 months ago, 4 months ago, they did not. And I can thank Dr. Ross for his brilliant work and the help that he's given me, and I'd like to introduce him now. And this is Dr. Joseph J. Ross.
How you doing?
How are you?
Good, thank you.
I'm going to put these back on though because the lights are bright and I'm sensitive. Listen, I just said, you're an amazing ophthalmic surgeon, and that's been my experience. And actually coming into your office for my visits, I've seen a lot of people here, and they're all very appreciative of the work you're doing for them. I also know in the hospitals, for the different surgeries that I've had with you, you are highly respected. I was assured by the nurses in every instance that I was in the best hands imaginable and that I need not worry. And I really wasn't worried. But the thing that fascinates me about you, you did a great job on my eyes, and they're healing for the first time in many, many years. And I look almost normal, they're healing the way a normal eye might look. So enough about all that. You did it, it's great, but there's so much more about you. And in my work to bring to an awareness to the people in Cleveland and anywhere else for that matter, an awareness of world-class people doing world-class kinds of things in Cleveland, Ohio, but living in Cleveland. And you are, in your practice, you provide an aesthetic that is very unique. I imagine it's very unique, at least it was for me, with regard to a variety of things. And we can talk about that in a minute. But first, I would love it. Can we talk about the work you're doing regarding stem cell research? You blew my mind when you mentioned that one day, and I really would love for you to share with us what you're doing. What are you doing?
Sure. There's a lot of new developments in stem cells for all areas of the body. And for facial area, which is what I concentrate on, what we're doing now is taking stem cells by doing liposuction and harvesting the stem cells from the fat with liposuction, and then using those as injection techniques in the face to rejuvenate the face, remove wrinkle lines, and improve essentially your baby face that you had when you're younger. The other advantage that we have with doing this technique is not only are you moving fat with the liposuction, you can do your thighs, your hips, your stomach, and getting a good cosmetic result, you can take those same stem cells and we can bank them through stem cell assurance. And if anyone wants to look at that, you can look at stemcellassurance.com online, and they will actually bank your stem cells. And so that if you have any medical problems down the road, you have stem cells that are banked, whether it's a heart problem or leukemia or lymphoma or a muscle problem. You have banked stem cells that are healthy and can be saved for years with cryopreservation with stem cells.
Well, that's amazing. Now, I understand that also for women who've had mastectomies, breast tissue can be recreated. Is that also possible?
Absolutely. And currently, I limit myself to obtaining the fat and doing the reconstruction on the face. But I do work with some plastic surgeons who are actually doing breast reconstruction and also cosmetic breast enlargement using your own fat cells. By taking the fat cells, harvesting the stem cells, and you can usually get at least 1 cup bigger size with your breasts through this procedure.
And it's easily tolerated by the body because it is part of the body.
Yeah,
anyway,
it's your
so
natural
it's amazing.
fat, so it's the best thing you have available. It's yourself, and it doesn't get reabsorbed. It's permanent. You don't have to worry about the problems with implants down the line.
Right.
It's like your natural.
Now, what happens under the skin if you're injecting stem cell into the face?
Yes.
And how long does it take before it's actually effective?
Well, the actual stem cells, because you're injecting some volume, you actually get an immediate response, with it. So you can actually see an instant response by just at the time of the injection.
And how long does it last? Does it eventually develop into a permanent
It
kind of
does.
thing?
It does. It actually stays permanently. So there's a lot of great new ways of rebuilding your face. The things you have to look for is first function and structure. You want to do things that you do no harm to the face. You want to make sure if you're doing anything around the eyes, the eyelids are going to still work normally, your vision is going to be preserved, you can be able to blink normally, that the bone structure is normal. And actually the most complicated part on the face is the eye area. So that's why in my training, I'm board certified in ophthalmology and I'm board certified in facial plastic surgery. So after ophthalmology, I did the plastic surgery part, which actually was the easier part because of the eyelid, it's the hard part. And you want to make sure everything's working normally. But then secondly, you want to get the best cosmetic result. So you want to have someone who looks younger, is more pleased with their appearance, improve any defects that they may have had, whether it's from trauma, like I've done a lot of reconstruction work working at Metro Health Medical Center with the trauma, or just because of injuries they've had, or just because they're getting a little older and things change when you get older and you want to get that youthful appearance back. And there's really not much more important nowadays as far as the workforce and being involved in a social situation than your appearance.
Yeah, it's very important. And I don't know, it may be unfortunate that so much is made of our appearance, but it's kind of exciting to know that you can have a natural effect without serious surgery and all of the concerns that would create for me anyway. The thought of all that, it was enough to get the eye surgery was pretty intense, but this is very, very exciting. Now, what other applications are you working on now with regard to stem cell? Is there anything beyond what we're talking about now that's coming up, or anything new that we're waiting to know more about?
Well, I've had an ancillary interest in some of the new stem cells for the eye.
Okay.
Right here in town, the Cleveland Clinic and Case Western Reserve is doing a lot of research with stem cells for the retina, for people with macular degeneration, to try to regenerate the macular cells and give some vision back to these poor people who have lost so much of their vision and their useful life from macular degeneration, which is not really curable now. But the stem cell research you're doing right here in Cleveland is going to probably pioneer a lot of that research.
And so the big commotion about stem cells in the past and whether it was a good idea or not, I think that there's some indication it's a very good idea.
Absolutely.
Because it can help a lot of people in the future. Are these procedures available in this country, or is this in other countries?
Well, the retina work right now is still in a lab type setting,
Okay.
so it's not really available yet for people to have done, although they're working on that.
Okay.
The other procedures that we're talking about, whether it's the breast enlargement or the facial enhancement, is absolutely available in the United States.
That's fantastic. It's very exciting to hear about it, and it would give you a natural look too. I mean,
Absolutely.
without that drawn, tight, whatever, plastic surgery look. Now, tell me a little bit about in your practice as an ophthalmic surgeon. I was impressed because you not only were concerned with my eyes healing naturally and being and working and functioning and all of that, but you understood that I had some concern about how I was going to look when it's over with. because
Yes.
I had been advised by a couple of people, as you know, that I was going to have a rather radical surgery that would leave me with serious facial scars. Fortunately, that didn't happen with you. You assured me that wasn't necessary, and I'm so grateful for that. But I know that your approach in your practice has a lot to do with, I'm calling it aesthetics because I think of aestheticians, and so I don't know what else to call it. But you know, there's so much more here than just you're getting your eyes checked out. You can come here for facial, skin rejuvenation. Well, I mean, I understand you even have this kind of you have the liquid facelift that people are talking about, and
Yeah.
you know, I imagine people in Cleveland would love to know more about it because I would have imagined it's only available in New York or LA or someplace, but I understand that that's something you specialize in as well. Now, what is a liquid facelift? What are we talking about?
That's a very good question, because in the past...
Wait a minute.
Oh, okay.
Wait a minute. Before you go there, I mean, I'm not happy. Like, you know, I'm a little vain, a lot vain. I'm not happy about some of this stuff, you know, so I don't know if I would be a candidate or not. But I mean, somebody like me could benefit from something like what you're going to be talking about.
Oh, absolutely.
I could?
Absolutely.
Okay, just
No,
wanted to
yeah.
know. Okay, go ahead. Tell us about radium.
Sure. Well, you have to have a little background as far as how plastic surgery has evolved over the last few years. And actually, it's only within the last several years that we've taken a totally different approach to cosmetic facial surgery. In the past, cosmetic facial surgery is how much can you remove? How many wrinkles can you remove? How much fat can you remove? You know, how tight can you make something look to make it as though there's no wrinkles? And then through a lot of really good research, and some by my mentor, Dr. Dryden, who's in Arizona, come up with the idea that that's not youth. Youth is actually plump, full cheeks, fat in the right areas, things that settle down over time, so your face kind of falls over time because of the fat pads in this area tend to fall down, giving you the lines in the nasolabial fold area, the marionette lines, and the kind of flatter cheek area that actually is one of the signs of aging. So instead of going in and removing all the fat under your eyes or trying to tighten you up really tight and gives you that plastic surgery facelift appearance, you want to get the natural appearance back by lifting things. And one of the really great new things that's come out is the liquid facelift, which is it's a lot longer lasting than other fillers. When fillers first started coming out, they came out with collagen, which was your first filler, and that actually was derived from animals, and there was a lot of allergic reactions to it. It didn't last very long, a few months, and then other fillers came out that lasted longer. But Radius is one that really lasts a long time, gives you the advantage of lifting the area in through here. See, if you lifted the area up through here, giving you nice fuller cheeks, it gets rid of that nasolabial fold by a mini facelift. Gives you instant result by filling the cheek area to lift up and get rid of those lines. And you get an instant result with it. You may have a little bruising or swelling for 24 hours, but usually within 1 or 2 days you're back at your normal activities, and it gives you a great result that's more natural, like you were when you were younger.
Does it hurt?
No, not
He
really.
says yelling.
No, no.
No?
One of the newer advances with this I keep calling it medication, it's not really medication,
Yeah.
with this material is that we actually mix a little bit of xylocaine, which numbs it up. So when we do the injection, they're really actually pretty tolerable to do.
Fantastic.
Just done right in the office setting.
That's pretty exciting.